Imagine living in a world where a simple bite from a body louse could lead to a life-threatening illness, an infection that once swept through cities, prisons, and war camps, leaving devastation in its wake. This is not a story from the distant past alone. Epidemic typhus, also known as Louse-Borne Typhus or jail fever, is a disease that has shaped history, and even today, remains a threat under certain conditions. Understanding epidemic typhus is key to preventing its return, recognizing its symptoms, and ensuring swift, effective treatment. Let's explore this disease step by step, beginning with its symptoms, moving through diagnosis and treatment, and finishing with practical prevention strategies. First, what exactly is epidemic typhus? Caused by the bacterium Rickettsia prowazekii, epidemic typhus is classified as a rickettsial disease. Unlike many bacteria, Rickettsia prowazekii can survive only inside the cells of another organism. Humans are its primary host, but in rare cases, flying squirrels in North America can also harbor the bacteria. The disease is most famously transmitted by body lice, tiny insects adapted to living in the seams of clothing and feeding on human blood. Outbreaks of typhus historically flourished where hygiene was poor, and people were crowded together, such as during wars, civil unrest, or in impoverished areas. Symptoms of epidemic typhus. Epidemic typhus does not creep in quietly. Symptoms appear suddenly, usually 7 to 14 days after the bacteria enter the body. The onset is dramatic. Individuals experience a high fever and an intense, pounding headache. Fatigue is profound, leaving the person utterly exhausted and weak. These initial symptoms are often accompanied by chills, muscle aches, and a general sense of malaise. After 4 to 6 days, a distinctive rash makes its appearance. It typically begins on the chest and then spreads to the arms and legs. Unlike some other rashes, the one seen in epidemic typhus usually spares the face, palms, and soles. The rash may start as small pink spots, but it can become more widespread and darker as the illness progresses. In severe cases, other complications can develop. The spleen may become enlarged. Blood pressure can drop dangerously low, potentially leading to shock. The kidneys may fail to function properly, and secondary infections like pneumonia can occur. In rare and advanced cases, gangrene, tissue death due to lack of blood supply, may affect the fingers or toes. If left untreated, epidemic typhus can be fatal, especially in older adults or those with weakened immune systems. Historically, outbreaks have claimed thousands, making early recognition and medical intervention critical. Diagnosis of epidemic typhus. Diagnosing epidemic typhus requires a combination of clinical suspicion and laboratory testing. Doctors first consider the patient's symptoms and history. Have they recently been in an area with poor hygiene or where typhus outbreaks have occurred? Have they had direct contact with lice, or, in rare cases, flying squirrels? The sudden onset of fever, headache, exhaustion, and a characteristic rash can raise suspicion for typhus, especially if body lice are present. To confirm the diagnosis, doctors may perform a biopsy of the rash for laboratory analysis. One common technique is an immunofluorescence assay, which looks for specific markers of the Rickettsia. Bacteria in tissue samples. Alternatively, the polymerase chain reaction, or PCR, can be used to detect the genetic material of the bacteria rapidly and accurately. Blood tests play a supporting role. These tests look for antibodies produced by the immune system in response to Rickettsia prowazekii. However, a single blood test immediately after the onset of illness is not sufficient. To confirm the diagnosis, the test is repeated 1 to 3 weeks later. If the level of antibodies rises significantly, it supports the diagnosis of epidemic typhus. This is because the immune system needs time to mount a response detectable by laboratory methods. Treatment of epidemic typhus. Fortunately, with modern antibiotics, epidemic typhus is treatable, and recovery can be swift if therapy begins early. The drug of choice is doxycycline, a member of the tetracycline family. Doxycycline is given orally and continued until the patient has improved and has been fever-free for at least 24 to 48 hours. However, a minimum of 7 days of treatment is recommended to ensure complete eradication of the bacteria. It is worth noting that although some tetracyclines can cause tooth discoloration in young children when used for extended periods, studies have shown that short courses of doxycycline, ranging from 5 to 10 days, are safe and effective, even in pediatric patients. This makes doxycycline the first-line therapy for typhus in both adults and children, without significant risk of lasting side effects. In severe cases, hospitalization may be necessary to manage complications such as severe dehydration, low blood pressure, or organ dysfunction. Supportive care, including fluids and monitoring of vital signs, plays a crucial role in recovery. Prevention of epidemic typhus. The best defense against epidemic typhus is prevention, with a focus on controlling the spread of body lice. Personal hygiene is fundamental. Regular bathing and changing into clean clothes greatly reduce the risk of infestation. Clothing and bedding suspected to be infested should be washed in hot water and dried at high temperatures, which effectively kills both lice and their eggs. Dry cleaning is another effective option. In situations where lice infestations are identified, prescription medications such as lindane or malathion can be applied to the skin to kill lice. Public health measures in crowded or high-risk settings should focus on delousing campaigns, education about personal hygiene, and improving access to clean water and laundry facilities. Avoiding contact with flying squirrels and their nests is recommended in regions where they are known to carry Rickettsia prowazekii. Conclusion. Epidemic typhus is a disease deeply intertwined with human history, but it is not consigned to the past. Its symptoms, sudden fever, headache, exhaustion, and rash, should prompt immediate medical attention, especially in individuals exposed to lice or at risk in crowded, unhygienic environments. Swift diagnosis and prompt initiation of antibiotics save lives. Above all, maintaining cleanliness and controlling lice infestations are the most effective strategies for preventing future outbreaks. By understanding and respecting this formidable disease, we can prevent its resurgence and protect vulnerable populations worldwide.